Welcome to the #1 show and the source of truth for all things MedTech. Here, we reveal the secrets and stories behind the investments, science, and commercialization of the MedTech industry. Every week, we'll take you on a wild ride with the biggest names in the game, from entrepreneurs and investors who are shaking up the market to healthcare providers who are revolutionizing the way we think and practice medicine. So hold on tight and get ready for a journey like no other. This is the State of MedTech. What's going on, everybody? Welcome back to the show. And we got a special guest, a good friend of mine. Many of you and many of the people in the world of orthopedics call him the godfather of orthopedics. Some of you know him as Dr. Kirschenbaum. I know him as Ira. And that's my good friend Ira Kirschenbaum, who's chair of orthopedic surgery at Bronx Care, but also the founder and editor-in-chief of JOEI, JOEI. What is JOEI? It's one of my favorite journals. And that was not a paid promotion. I really mean that, and I'm going to explain why. First, we're going to be doing more of these episodes, which are orthopedic updates, but more specifically, I want to do ones around JOEI, which is the Journal of Orthopedic Experience and Innovation. So JOEI, and if you want to learn more, go to JOEI, JOEI.pub, is a journal that's focused on information-based practices from surgeon experience or innovation in the field of orthopedics. What does that mean? Well, a lot of times when it comes to new innovations, new techniques, it's like a year or so before you hear about them either in let's say your traditional journal or on podium. And so many surgeons have learned from the experiences and innovations of their mentors and many orthopedic surgeons who've came before them, right? And the Journal of Orthopedic Experience and Innovation, they want to capture all the current experiential and innovative research. But here's the part that's amazing. It's true open access. It is a complete open access journal, which means there is no subscription fee, and remarkably, there's no article processing fee like other quote unquote open access journals. So there are no barriers to submission or reading. The best part about this journal is that aside from amazing pieces, I'm going to be submitting a piece for publication myself, but they also do a great job nurturing the orthopedic community on LinkedIn. If you notice all these great cases being posted on LinkedIn with orthopedic surgeries and cases, that's Ira who kind of started that grassroots effort. And if you have an interesting case in orthopedics, when you post it, tag Ira in the journal and also use the hashtag JOEI, JOEI. And so this episode is about that. Now, one last thing I want to share is I have a very exciting announcement myself. For many of you, you know that my big passion is not only psychology and persuasion, but the idea of product adoption and driving it. And so we live in a new age, right? As a surgeon, it's not like back when my father was practicing, where the only way you get some recognition is if you go up on podium or publish. My father was a private practice surgeon. That was never going to be him. But now with the advent of social media, it's really democratized the way that we can become key opinion leaders. And that's where the birth of the digital opinion leader came forth. That concept was something I read about actually in JOEI a while back. And it really inspired me because I personally want to teach and help physicians who are interested in becoming digital opinion leaders to develop not only their brands online, but more importantly, how do you do it so that startups and innovative medtech companies come to you for advice? And if you decide to get more involved with a company, how do you do more than just use their products and talk about it amongst your peers? How do you drive product adoption at scale? How do you design an online presence where all kinds of opportunities, whether it's investing, medical partnerships, anything else can come your way, or in my case, even start a business? Well, that's why I started the Digital Opinion Leadership Masterclass, and I'm starting with orthopedic surgeons. So I'm doing an early bird special. You can get the course for a really highly discounted price. And the best part is that the course comes with 25 AMA PRA Category 1 CME credits. That's right. So for a few $100, you can get 25 CME credits by unlocking them. And you can become a digital opinion leader, which means going through an amazing content that I put together. Plus, there's a private group where you can be connected with other DOL orthopedic surgeons, and we're going to be doing live coaching calls as well. So a lot of great opportunities for you. I'm really excited to roll this thing out. So now you can get access to that course. All you got to do is go to www.orthodigitalopinionleader.com. That's www, and it's very important you type in www online, orthodigitalopinionleader.com, or just check the show notes below, click that link. So with that being said, let's get on to our episode with Dr. Ira Kirschenbaum on updates from JOEI. All right, everybody, welcome back to the show. I got a very good guest, a very good friend of mine. You know him as the godfather of orthopedic surgery, the chief and editor over at the Journal of Orthopedic Experience and Innovation, otherwise known as JOEI, Ira Kirschenbaum. Dr. Kirschenbaum, thank you so much for joining us. How are you doing?
I'm doing great. I really am. The department's going well, knock on wood, here in the Bronx. And JOEI has been just an incredibly exciting experience, and especially every year, this is our third year. JOEI, someone said you guys are like Ivy. First year, second year you creep, and the third year you leap. So, we're found that this third year has been just remarkable in how many people have discovered us, discovered what we're doing, discovered why we do what we're doing, how we do it, and what we do every day. We've got over 120 editors, 30 people on our advisory council. So I have over 160 orthopedic surgeons involved in this social experiment called the Journal of Orthopedic Experience and Innovation.
And I got to tell you, it's one of my, it is my favorite journal, because there's, what I love about it is that it, the spirit of it is real surgical practice, which is like updates from the field, new techniques and everything, and not waiting over a year for it to be published in like the New England Journal of Medicine or JAMA or something, So those journals are great. They serve their function and purpose, but I'd say JOEI is different. It's a different journal. And by the way, last we saw each other, it's at it's the JOEI mixer at AAOS, which was awesome. I gotta say, it was very much a who's who, not of orthopedic surgery, but a who's who of like ortho LinkedIn. So it was quite a blast.
I can't tell you how many times people said, "Hey, Stefano Giraldi, I have not seen you ever. Wow, you're here." Oh, you're this guy, And it was, we had about 250 to 270 people. People said that JOEI should just go into the event management company, event planning and management of mixed.
I mean, I'd be totally okay with that. I mean, that event was awesome. And, just for people who are listening, just a reminder, if you're a clinician, this episode is eligible for a CME credit. So, you get an AMA PRA Category 1 credit. Just click the link below and just write down what you learned. And of course, along with the links, but if you're driving, just to remind you, JOEI's website, which I recommend going to check out, is Journal OEI. So that's Journal of Orthopedic Experience and Innovation, scholasticahq.com.
We since shortened it.
Oh, you since shortened it? Do you know how much time I spent memorizing that, man? Come on, Ira. What's the new one?
The new one links to that one, but the new one, they just put in JOEI, JOEI, .pub. JOEI.pub will get you.
Oh, perfect. Yeah, JOEI. That's awesome. That works. Yeah. So we got a lot to talk about. So before we get into some of the bigger topics, I wanted to get like sort of a quick around the horn updates from the world of orthopedics. Some interesting news came out, so I'll let you kind of take it from there. What's new in the world of ortho?
Well, let's see. The old wars are still going on, and new wars are still are brewing.
What a hell of an opening! Okay, what are the old wars that are still going on?
Okay, people. It's actually once you've been around as long as I have, which is over 20 years, but I'm actually over 30 years. But once you've been around, you begin to see how some of the things that you thought were resolved 20 to 25 years ago are coming back again, and people are fighting with the same fervor that they fought 20, 25 years ago, and then resolved them. There are the cement versus cementless wars in knee replacement. Cemented knee replacement with polymethyl methacrylate, which is standard bone cement, been around since the 70s, 1970s, not 1870s. Right? And or do you do an uncemented joint replacement? And one costs more than the other. Other people say certain things fail. One's faster in the operating room. It's all these back and forth. The funny thing is, having seen those wars in the late 1980s, early 90s, the words are exactly the same. The people just look different. That's it. These young, there was a big controversy on this on LinkedIn, and finally I just piped in and says, guys, do a Google search, man. You're going to find like 20 articles on this from 1990, and read them and just repeat them. So that's the example of an old war. There's a lot of stuff on robotics, which is the best.
Yeah.
Yeah. I mean, whether or not you should use robotics or you should use some type of non-robotic navigation unit that lets you make the cuts better. And, the robot has a navigation and a cutter, while on the other hand, the navigation tools represented by some companies like OrthoAlign or OrthoGrid, they're just tools to let you as the surgeon cut better. And not only the last chapter hasn't been written, I don't even think the prologue has been written yet on this. And in fact,
what do you mean? What do you mean by that?
That means it's so early in the war right now. People think, oh, we'll have a seminar, and at the end of the seminar, we'll all decide. Nah, you're just putting more fuel on the fire. This is just beginning, because what's happening is there are so many variables and we love the articles in JOEI that talk about this. And the joke I have, by the way, one of my friends, Craig McAllister, said, the other name for JOEI is the Journal for the Rest of Us, So you should just call it Rest of Us Journal.
I like that. That.
So you grab restofus.com and restofus.pub, just for fun, and let insiders use it. But
why do you think these the cement versus cementless? I mean, why is this coming back into discussion? Like, what do you think is fueling that?
I think new technology and cementless. What happened was the original cementless designs were not as elegant as the current ones, and did not work as well. Now that we've developed newer types of bone ingrowth surfaces that are much more effective on having bone grow in, they decided to apply them to knees, and they do save about 15, 20 minutes of operating room time. And but I won't go into the pluses and minuses.
Is the cost justified, though? I know that's kind of a broad topic. It's depending on a lot of things, but do you think, like, for that extra 20 minutes of time, is the cost justified?
No, the cost of the uncemented implant in most places is significantly higher than the cemented one. It's the same implant as far as the way it works in the joint. It's just the attachment to the bone. And I feel when people say, well, it saves 20 minutes of OR time. And I said, listen, I know surgeons who do this operation in an hour and a half, and I know surgeons who do it in 45 minutes. You want to save 20 minutes of OR time, send it to the second surgeon, okay? And don't do the OR. So OR time is, not everyone's doing it at the same time anyway. So it would be like me doing a Formula One race versus Formula One drivers, and you telling me I could save 20 minutes in the pit. Like, these guys are lapping me 6 times to begin with. So OR time, I don't buy the argument. I like I happen to be a cement guy, okay? Because you could put antibiotics in the cement. You can't put on high-risk patients. You can't put antibiotics in uncemented. But, these are the old wars and that are coming back because of new technology. A new way to fix to the bone brings up an old sore, and we're finding that all along. Even one of our most popular articles is, we have two very popular articles that both went over 10,000 views, which, the average orthopedic article is lucky to get 25 to 70 views.
Right.
So we're averaging 505 views per article. But two of our articles are emblematic of new concepts that are coming to the forefront because of either changes in regulation or changes in software. One was an article on private equity written by Gary Hirschman, Hector Torres.
That one blew up. I remember that one.
Yeah, and Dana Jacoby. And that one was really a roadmap. I call them roadmap articles. And internally at JOEI, we have terms for many of our articles. And this one's called a roadmap article. If you read this article, you essentially have put into ways, take me to private equity land. And this article is the ways of private equity in orthopedic groups. That's probably why it's so popular.
But what about? I think there's something deeper going on in the zeitgeist of ortho that made that private equity one blow up. Do you think it's because orthopedic surgeons are trying to combat consolidation by hospitals and teaming up with private equity to stay independent? Do you think it's just that, what about it? What about private equity? Do you feel like, because in the last 2 years, it's been a huge topic in orthopedics. Why do you think that is?
So some people are afraid of private equity because they're afraid that some business person is just going to talk to them about the bottom line.
Well, isn't that how most surgeons are operating anyway these days with hospital administrators?
411, guys, if for those of you who are too young, 411 is a number you call for information. So, well, 411 on this is that running any practice can't happen if you don't generate enough revenue and save costs. So you might as well have a partner that you choose that you potentially can throw out rather than a partner that, a lot of private a partner that you can't do that with, which sometimes is a hospital. Okay. Hospitals are buying practices, and some hospitals don't have the ability to run those practices. They're just acquiring warm bodies for referrals. Mm-hmm. Some hospitals run practices quite well. It's variable. But I will tell you, from what I can see in the private equity world, the private equity buyouts that I've seen have had exceptional management in improving efficiencies in the group. And the ones that I have seen, and some people can show me others that may be different, have not interfered with clinical decision-making, okay? I recall years ago, one of my colleagues joined a very large orthopedic group, and he didn't do enough cases. He was a little more of a conservative surgeon. So they got rid of him. These were orthopedic surgeons, not private equity. So what you're saying is business practices are business practices, Now, he might not have done it because he said it was because he's conservative. Maybe he just didn't market his practice well. I don't really know what happened there. But I think private equity is a big hot topic right now. And what's still a topic is efficiency in a hospital or the ASC. Efficiency in the OR, efficiency in your care of the patients. With equivalent outcomes. You want high-end efficiency, high-end efficacy. And that is possible. Okay. And that was a second article that came out in JOEI called 12 by 12 by Charlie DeCook and Jeremy Statton, where they get 12 joint replacements done by 12 noon. And then Charlie goes out and plays pickleball, Now, I don't know if the motivation is his pickleball schedule or the motivation is the OR. And he wrote a beautiful roadmap article on how to grab, even if you're not going to do as many as he does, if you do 4 by 4 o'clock, you follow the principles that are in this article, you are going to do 4 by 2 o'clock, not 4 by 4 o'clock. Because we are learning that you can apply principles from other industries. And that was that article in JOEI. And I'm always amazed when I see an article in JOEI that shows people another way to use a product or another application. Especially, we're seeing a number of biologic articles of
biologics has been another really big hot topic. And I wanted to ask you, is it because that there's a patent cliff for some biologic companies and new ones are coming into the market? Is it because that it's starting to gain more mainstream adoption? Why so much talk about biologics recently?
I think it goes a little bit along with what I talked about with the cemented interfaces. The biologics have gotten better. There's the companies that have been producing them have had some great advances in science behind them, whether that's in injections for arthritis or whether they're biologic patches for augmentation for rotator cuff tear, or whether they're an augmentation for an anterior cruciate ligament repair. Some very smart people, just for example, Kevin Rocco from BioRes.
Oh yeah, great guy. Yeah, they just got acquired too.
They got acquired by ConMed Lymphatech, and he trained as an engineer at a very small unknown college in New Haven called Yale. And I don't begrudge him. I went to Brown, so I don't begrudge him having to have gone to that college. But he invented this himself. I mean, he invented this in the lab. This is an improved scaffold that we've had 2-3 articles in JOEI on use of that scaffold in different parts of the body. And Mike Redler from Connecticut used it in a chronic Achilles tendon repair, which prevented him from having to use an allograft. And it gets incorporated and it gets stronger than an allograft, is the promise. And study upon studies are coming out now on biologics. We, I believe, were the very first article on the BioRes. And then Kevin got acquired like 6 months later. And I'm still waiting for my 10%, by the way. I just want to
know, yeah, Kevin, if you're listening, Yeah.
I thought that's what the deal was with producing the art. Oh, that's not how publishing goes? I mean, look, Ira, and by the way, because I'm sure there's going to be that's public service announcement guy. There's always somebody who wants to message me about something. So just so people know, I have a lot of respect for Dr. Kirschenbaum. That being said, we've become good friends. We have hung out virtually in our respective man caves on Saturdays. And so that's why I feel comfortable calling him Ira. So now that we got through the formalities, I'm just going to call him Ira, which is I'm used to. But no, Ira, I was going to say, I was like, look, I mean, JOEI's been pretty innovative on the publishing side. Like, I don't see why it would be out of the question for a publishing company to say, hey, we will help publish some of your key pieces, which will gain a lot of market awareness, so on and so forth. And in exchange, we'll take a very small sliver of equity. I think that'd be very interesting. I mean, I don't see why not, Yeah. It just has to come in a paper bag and $100 unmarked bills, and I think I'd be fine.
Or Bitcoin, right?
Or Bitcoin, yeah.
Ira, look, while we're talking about it, that's the next thing JOEI needs to do. JOEI needs to do an initial coin offering and launch its own NFT with digital currency, like Ortho coin or something.
Yeah, it works for somebody who's running for president, so maybe it'll work for me. I want the price $99. That's it.
Yeah, there we go. Exactly.
We have 2 articles, one on blockchain and one on cryptocurrency and orthopedic.
How did those ones do, by the way? What's the appetite? Because I'll tell you, the venture capital hype cycle in the last 18 months was wonderful. It went from the metaverse to Web3 to Bitcoin, and then it blew up. Now it's on to generative AI. Who knows what the hell it's going to be 6 months from now? But how did the ortho community take on the whole blockchain discussion? Mid-level interest, I'd have to say.
Let me look at the blockchain. And they were written by some good guys. Oh no, the blockchain got 439 views. Understanding why physicians should care. Okay.
What was the most contested and controversial Joey article?
Wow.
If it was such one, which I'm sure there is, which is why I'm asking.
Yeah. It's very interesting that we will get generally good, people on LinkedIn tend to be kind and not be contested. But I would have to say the articles on virtual reality.
Really?
Yeah.
All right. Unpack that a little bit.
Yeah. So I'll tell you in a couple of ways. There's two areas where people talked about it. One was what I'll call the non-believers. All right. I'll give them a name. I'll give them the non-believers. And they were people who basically said, there is no way that you can prove to me that simulation learning can even remotely replace good mentoring in the operating room. That was the big war, because the VR people, and I love it. I love the VR concept because I think it augments the mentoring.
I agree. That's the right term. Is it augments?
Yes, it has to augment because if anything, it gets the young surgeon's hands moving, sees the anatomy, sees this, sees that. I'm not sure the haptic, meaning that the feel stuff is like regular tissue, but there's a fear, like there's a fear of robots taking the place of humans and all this kind of fear. That we're going to live in an iRobot world one day. There's a fear that some training programs may substitute simulation training and the attendings will be a little lazy and sort of, oh, good. Thank God the resident's out of my operating room now or something like that. And so there were clearly the non-believers and what I call the protection of the abusers. In other words, people would have people doing a lot of training with VR and say, oh, they got trained in this operation, when in reality, they didn't really get the same type of training and mentoring. But maybe that's just sour grapes of a bunch of older guys like me saying, back when we trained, ... we worked real hours. We worked like real orthopedic surgeons, So I'm not, again, VR, the thing that also is, it's just too early to tell. It's still in its infancy. What Danny Goel has done in Precision OS or Justin Barad has done in OSSO VR, great stuff. Great stuff. But I can't wait to see what that looks like in about 3 to 5 years.
Yeah, I agree. And I think that's the thing that people have to keep in mind is that with new technology, all technology, no matter how great it is, has to go through an adoption cycle. And that adoption cycle, I think people, because of how fast things move in the consumer world, we assume that that's, that if it's not like a household name within a couple of years, that it's not going to, be widely adopted. But, we forget that a lot of these things, it takes time to change behavior. You know what I mean?
Right.
And especially if it's, it's not only the adoption of the new thing, but it's also the death of the old thing, right? Yeah. And those things don't coincide on the same timeline, Yeah. It's just like that's why, look, like people forget, but like if you look at robotics across the board in surgery, general surgery, orthopedic and everything, the adoption for robotic surgery is something like, depending on what you look at, ranging from anywhere from 3 or 4% to the very highest at like 14%, depending on the specialty. Yeah. That's not much. And the reason why that is that there isn't the death of the old way of doing surgery. And there's not a need for that, right?
Well, there's also a lot more at stake when you change what you've been doing. So a total hip replacement without a robot, based on outcome studies, have a 97 to 99% patient satisfaction rate. Mm-hmm. All right. So what's the promise of the robot to someone who's experiencing that or have read all those studies? This is not like an iPhone. And also, if you change, what are the consequences if you change? It could be negative.
Yeah.
You could.
That's a great point.
You could put in wrong. There's no negative consequence to going to the iPhone 12, even if it stinks, because they'll eventually recall it. We can't recall a bunch of people in hips.
Mm-hmm.
You know, there's more at stake in adopting certain technologies. The technologies I think that adopt faster are the ones where we don't have great results on now. Like, for example, the rapid adoption of the BioRes patch, for example, or there was one called Regeneton patch, which was the first one that came out. That became a Smith & Nephew patch. That solved the problem that people did not have a solution for. Large, irreparable rotator cuff tears. Mm-hmm. It wasn't like they were giving up something that had a 98% success rate because something was just cool, you know? So if you're going to mess around with total hips because the robot's kind of cool, it's very much like the old joke where the nerd goes to the pond and he sees a frog, and the frog says, "Kiss me, I'm a beautiful princess and I will fulfill all your greatest desires if you kiss me." And the nerd says, "Wow, cool," and puts the frog in his pocket. And you can imagine this goes on and on and on and on. If we were drinking some bourbon or scotch, we continue telling various versions of it. And then eventually the frog princess says, "Why aren't you kiss me? I told you what would happen." He says, "I have no use for all those riches and a beautiful princess, but a talking frog is really cool." So we don't know if some of these technologies are princely or are they just cool, you know? And if they're just cool, it's hard to convince an orthopedic surgeon who's in Reading, Pennsylvania, or in upstate New York, like Andy Wickline, who does over 900 joints a year, and happy patients to try something new from that happiness. So that's the challenge of some of the technologies, because they're up against some really good results from techniques.
Yeah, and I think that's one of the more important things, in my opinion, when it comes to new medical technology, is that it's assumed. Like, I could talk to a guy on the street who'll say, "Yeah, I raised some money. I have this thing for this procedure." I already know, like, okay, it does make things better. The question is that by how much more, and what, like, what is it a limit? Like, you know, it has to be, you know, the margin for results have to be so big and dramatic that it has to make sense. And I think that the other thing that people, you know, don't realize or appreciate, especially VCs, because there's a lot of VCs and investors who, okay, if you let's look at trillion-dollar companies, Amazon and Apple and Google.
Right.
When you are a publicly traded company, your fiduciary responsibility is to grow. And when you're that big, Apple's not going to come out and be like, "Let's just start making furniture." They need to look for things that are going to make a huge, huge difference. So what's left? Hey, how about the thing that 21% of our GDP is spent on, which is healthcare, right? So
involved healthcare.
But the problem, and in my opinion, the reason why tech failed the first time, you know, Amazon and the Berkshire Hathaway, JP Morgan venture, so on. Is they came on with a tech business model, and it just doesn't work in medicine. The one thing people forget about medicine is that physicians culturally are more followers than being sort of mavericks. Because if you break away from the herd and you do something wrong, like you will be outcast. You'll lose your license. You know, even if you don't lose your license, like, people don't forget that. Like, so it's a very dogmatic, judgmental, tough culture, especially surgeons. You know,
I mean, because we've done it, right? And I know you have familial experience with. Oh yeah. One of the things I say is, an innovation in medicine does not have to be a game changer, but it does have to change the game. And that's a little bit of a difference. People understand that. Like everyone's looking for the game changer. Haven, the JP Morgan will fix healthcare. No. Look at what was it Amazon or CVS who bought Pill Pocket? One of them.
I think it was CVS. I think it was CVS.
Was it a game changer? No, but it changed the game.
Mm.
It increased compliance for people who were taking multiple medications and complex medicines. Now, a lot of the CVS, I think, just bought One Medical or something like that. Like they bought a primary.
So Amazon purchased that, and what I think is interesting is that Jeff Bezos, if you read the history of Amazon, they have a history of trying things and having glorious trash burning failures, but then turning them into success. Like the Fire Phone, massive failure. The learnings from that translated to the Kindle. For Amazon, they had Amazon Care, huge failure. But I think now they acquired a primary care practice. That's a perfect example with enough volume in terms of what they purchase, what they use, all these things to get enough data and say, you know what? Now that we know that a primary care practice buys these things, we're going to produce these. It's kind of like what Amazon did with batteries. Batteries makes, I don't know, like $10 billion a year in revenue for Amazon because they had the data and they're like, oh, people buy a lot of batteries. We're going to make a battery, Yeah,
Amazon Basics batteries. I got them in my house.
Yeah, exactly.
Amazon Basics fleeces, it's, what does it take? But, very fascinating you bring that up because I think, the idea of Amazon buying the primary care doctors, in one sense, you're saying they're buying the critical piece in the decision-making pool of the cycle of revenue management in medicine. The doctor goes to you and says, you need a walker. You need this medication. You need this. Each doctor will see, let's say, 4,000 visits a year, 1,600 patients. You buy enough of these medical practices, then they will be buying products on Amazon. So you're buying the influencer of the customers.
Exactly. That is exactly right.
Brilliant move. If you can buy the influencers of the customers, it's better than advertising on the Super Bowl.
That is exactly. Ira, this is why I love talking to you. You're absolutely correct. And look, like I'll give you something like a really interesting perspective on that, and I'm gonna make a little prediction on the show. If you look at the Super Bowl, for example, okay, a Super Bowl commercial costs you about like $7 to $10 million. It's going to be viewed by about 100 to 120 million people once, maybe twice for 30 seconds, and you're done, right? Versus if you look at, let's say, a YouTube influencer like Mr. Beast, right? Creates a video, his average videos get 200, 300, 400 million views, right? Not on average, but like, and more importantly, those are going to be viewed more and more over time, right? And so in terms of like the way you view the Super Bowl commercial, 120 million people view it. Maybe if it's Mr. Beast and he makes a video of your product and let's say 20, 30 million people view it, 20 or 30 million people you can guarantee saw it, right? And they fit your demographic. And my prediction is that aside from the data, which is going to influence what kind of hardware and products you develop, I think the One Medical Amazon model is going to look very similar to, if you've been in one, the Amazon grocery store, which is you walk in, there's cameras everywhere, you just use your Amazon ID to get in, and you're able to just pick things up and walk out of the store. I think what's to stop something like that at a One Medical run by Amazon, which is you go and you see the doctor says you need a walker, you need this, you need that. Oh, by the way, we already sell those things. So when you walk on your way out, just go ahead and grab one and you leave with it.
Or not only sell one, we have them queued up on an Amazon kiosk.
Yeah. Oh, yeah, exactly.
So, for example, shoulder stiffness is a big problem in orthopedic. Shoulder stiffness after surgery, shoulder stiffness from a rotator cuff tendonitis. Well, orthopedic surgeons know this. Patient of shoulder disease know this. Okay. Doctors send people to physical therapy, which is 45 minutes 2 or 3 times a week, right? there's a lot more hours in the week than 2 or 3 times. So I happen to know that if you buy a shoulder pulley, which attaches to the door, temporarily, doesn't even have to screw it in, and you could use your good arm to pull up the other arm, you will solve your shoulder stiffness significantly. Now that pulley, where I am in the Bronx, I know a lot of patients can't afford a lot, so the hospital and the clinic, we stock hundreds of them, and we buy them on Amazon for $7 hold on.
And you're at the country's largest nonprofit hospital, which is Bronx Care.
Nonprofit safety net hospital, yes, safety net hospital, and so we have 85% of our patients are below the poverty line, and so we buy these pulleys for them. $7.47. I buy them on Amazon. And then a friend of mine called me up the other day and says, I'm having some shoulder stiffness from surgery. I sent him the link. He said, well, there's 2 of them, one for $20 and one for $7.99. We're talking pulleys here. I said, get the $7.47. I know it works, But the future is going to be with PillPack, with everything else. You have an Amazon account. I want you to fulfill it right now before you leave. Everything will get fulfilled before you leave. You'll get it tomorrow. No more of these durable medical equipments. We'll deliver it next Thursday or in 2 weeks, or it's out of stock. Amazon will have it for you, maybe even same day, which they often do, for $2.99 more, free shipping for Prime. They got that. But I think the idea of buying the medical practices is critical, because otherwise you're just another supplier. You're just another supplier. But if the medical practices are there, you are in the health revenue cycle chain. Okay. And you would never buy a baseball team that didn't have baseball players. Yeah. Let's buy Yankee Stadium. Let's buy Yankee Stadium. Or the Yankees said, no, the Yankees, I could sell you Ebbets Field. The Dodgers aren't there anymore. They're in godforsaken LA, wherever the hell that is.
I'm with you on there. No, it's
no one's buying Ebbets Field. It doesn't have the Brooklyn Dodgers anymore. Amazon's home run on this now, doctors are freaking out because they got private equity buying them, big hospital centers buying them, hospital systems buying them, for-profit hospital systems are buying them, and now Amazon's buying them. It's going to be a different world than when I started, which was when people were my age and when I was starting, is they thought medicine was in the trash, because you said, oh, it's not going to be the same for you guys. And I kind of really loved my career. And I just say to the new guys, it says, well, if things going to change, I said, of course they're going to change. But you will adapt to that change. Mm-hmm. You will adapt to that. It will be the new norm for you. And for doctors, and I have mentor a lot of young doctors, and I say, you are in it to treat patients. And as soon as you lose sight of that, you will become embittered. You will become a medical curmudgeon. All right. If it's always about the patients, it could also be about the business. It could be about a lot of things. But don't lose sight that I'm the chairman of the department. I saw 37 people in clinic the other day, and each one I treated like it was the first time I ever saw them. And you know where I got that from? A story. I got to tell you the story, Omar.
I want to hear it.
Okay. So I watched the Ken Burns baseball video. Okay. And one of the sessions, one of the innings, inning 3 or 4, was talking about Joe DiMaggio. And there was a true story about Joe DiMaggio that one of the announcers, sports writers wrote about, where the Yankees, it was in August, late August, Yankees already clinched the pennant, right? DiMaggio was up in the 7th inning. The Yankees were up 5-0. There's no one on base. There's 2 out, and he hits a slow fly ball to center field, and he's running as fast as he could to second base. The guy catches at the end of the inning. So the sports writer goes up to DiMaggio, and he says, Joe, you're towards the end of your career. Save your legs. What are you doing? You're sprinting like a racehorse or something. He said, you know something? There's kid in the stands, and this is his first and last baseball game, to be able to see Joe DiMaggio. All right. So while you will see 37 patients, each one of those patients is only seeing you. And that's,
I love that. I think it's a great lesson, especially, I mean, for any physician. This is one of the things that I love about medicine. There's a culture and art to it. No matter how much technology is brought into it, there's this art to it. And I really love that. It's also why I always love catching up with you and chatting. And I think those are the kind of things that you don't get to learn, unfortunately, in medical school or residency or fellowship. But if you listen to a podcast like this. Now, I do want to take a quick pivot. I have a question to ask you. So there's a lot of new orthopedic surgeons who are just learning about JOEI through this episode. And, the beautiful thing about JOEI is that, it's a journal for the rest of us, right? Anybody can publish, including, you don't have to be a clinician. Now, I submitted a while back a submission for JOEI. It wasn't published though, because it was more for like a blog article. What are your tips to people when it comes to what is worth being published in JOEI? Like, if you can give us like sort of a rundown like that. And then selfishly, this is also for me because I'm working on something and I'm trying to figure out what do I do to put it in a better position to be published on JOEI. So give us some tips on what are the best kind of ways to get published in JOEI.
Well, first of all, there are 2 or 3 groups of articles that we like. Our sweet spot is someone's experience with something innovative, something as simple as that. So, for example, someone used a new product and it's their experience with this new innovative product, or a new innovative technology, or in your case, what is a typical article we would look at, which we really like, is the impact of LinkedIn on the orthopedic community now versus 3 years ago. A series of interviews that you interviewed people. How did you use it back then? How are you using it now? Those are some of our softer articles. We have some hard articles of, following 100 patients through a certain device, but a certain device or technique. But certainly experience with innovation is number 1. 2, any roadmap article. I'll go back to that concept. How you should market your practice in orthopedics, or you will so you think marketing is not necessary? Let me tell you why it is. And it has to be written really with very good advice for the rest of us on marketing your practice. Or, for example, how are medical podcasts worth doing if you're a doctor? You're an expert at this, Omar. You've got a huge following. But for a new doctor to start off and say, I'm going to start a podcast called Bone News. I'm just making that up. And you and I know that's going to fail if this person has no presence on social media, no presence on LinkedIn, no presence on Instagram. Him and his, third cousin Martin are going to be watching this.
I don't know. The name Bone News, you might just get really lucky with the SEO, but I don't know. I don't know if that's the audience you want to attract, but that's a different story.
So that's true. It always reminded me of my very first website I wrote, which was in the early 1990s, was Bone Home. And Bone Home ended up being the foundation of Medscape Orthopedics, because Medscape purchased Bone Home from me for shares in the company, and then we went public. But Bone Home was the original Medscape Orthopedics.
Wow. Interesting.
A little orthopedic tech history there.
Yeah, I love it. No, I love it. See, this is why we have you on. I'm going to make another hard pivot. So just because we haven't caught up in a while, and again, like for the audience listening, I want to have Ira back on. If not monthly, like maybe once a quarter, even just to do these sort of updates around the horn and ortho. So you were at AAOS.
Yeah.
What were some of the memorable things that you saw at AAOS that sort of caught your eye? That was, whether it was controversial or exciting. What were some of the big themes coming out of AAOS?
So first of all, AAOS or AAOS Oftentimes it's not the place for innovation to spread out, because it's it's so big. People want to sell their base stuff. It's sort of like the innovator's dilemma. You want to sell innovation, but you don't want to lose the fact that a lot of people haven't seen what you sold last year. Exciting thing I saw, and I'm clear about this, was the return of AAOS. It was the largest meeting since 2019.
I didn't know that.
Yeah, so it was canceled in 2020, and 21 was in San Diego in like September, and then
it was terrible. And I was at the one in San Diego.
Right. So these people were genuinely worried, even after the one in Chicago. This past one was in Vegas, right? Yes.
Yep. Vegas.
And in the one in Chicago, people was kind of paltry attendance relative to what they had. And people were genuinely worried whether this was going to be the new norm. And Vegas this past year broke out and had a lot of people. Everyone was pumped. Everyone was juiced. Companies were coming out with their, biologics were all over the place. Robotics were all over the place. In fact, if you went up to a rep at a booth of a big company and said, "Do you guys still sell bone screws?" And the guy would go, "I don't really know. We sell robotics and biologics, but I don't know if we sell bone screws or cast saws." I mean, everybody was pushing the latest and greatest, but the number one innovation was the AOS being able to reinvent itself again. And I thought it was great for the specialty, because I think no matter how many of these specialty meetings we have that are very popular and very good, we need the AAOS to be strong, because it's the one place we all get together to see our old buddies and our old friends, and you can't see everything. It's like going to Disney World. That's why people go back.
That is very true. And again, for me, AAOS, that was that kind of kicked off a new tradition for me, because for me, through the podcast, through my marketing, everything, I can reach anybody and everybody. I don't have to leave home. But Joey was having events, so that was my excuse to say, "Hey, I'm going to go to AAOS." But I also took my family there, so I was like, my kid's only this young once, and this will be fun. And I had such a fantastic time. The sessions were great. The exhibit hall was a lot of fun. But then also these evening time events, like Joey, the Joey event. Again, you and I are friends, but I'm not saying this just to be nice. It was an awesome event, and for two reasons. Number one, the quality of people that were there, and then the quality of conversations. And the Joey event was only for, I think it was only for 2 hours, but it went on for it was like 6 to 8 p.m. or something, but people hung around to 9:30, 10 p.m. in there, because it was so much fun.
And at the bar, and it was great to see, because I was walking by there. There's a very well-known orthopedic surgeon, Don Buford.
He's my man for biologics. Don's great. Yeah, I gotta get him back on. He was my biologics guy. Yeah.
I'm walking past the bar, I see Don leaning back on the bar, and there's 6 or 8 residents and 4 other attendings talking to him, and he's holding court. And I'm going this is what Joey was made for. This is what the rest of us need, And in fact, it's funny. There's a big controversy right now on LinkedIn, going back to Joey, on one of the big journals, Neuroimage. I don't know if you read about this yet.
Yeah.
Imaged all 40 editors, or 40 or so editors, left in protest that they charge article processing fees of $3,750.
And I just want to make sure that people heard that correctly. To publish your article on these journals, which is technically the thing that brings people in for these articles to make money, they charge the authors $3,700.
Yes.
Okay.
Irrespective of whether you
including the copy that you ask the journal to send you, so you can have it in your office. Right. You got to pay for that.
Yes.
Yeah.
And they charge for reprints.
Mm-hmm.
So you can't get as many reprints as you want to give out. Joey has broken that model since day one. We have no subscription cost, no article submission fee, no cost to the author called an article processing cost, and no cost for reprints. We publish under Creative Commons license. So you could download 700 of them and, sell them on the corner, sell them in Culver City, for whatever.
And honestly, I haven't given up. I'm working on something. I'm going to get my first piece published in JOEI this year. I got a good one, and your feedback on whether either a roadmap or something innovative. So I got something. It's going to happen as soon as it happens. I'm printing some out and framing them. So I'm very much looking forward to that. Something that's interesting about JOEI, and this is a model that JOEI. I'm going to make a prediction, but you may or may not like this. But here's my JOEI will never be mainstream ortho, and here's the reason why. JOEI attracts a certain personality type that is needed in the orthopedic community, which is somebody who's going to be doing something very innovative, who's going to stick their neck out, and because they really believe in something, right? Because publishing in JOEI, in my opinion, like it takes some chutzpah to do it, right? It's not like other journals. When you're publishing in JOEI, right, you're putting it out there, right? And I think that brings a specific personality type, and I love that about JOEI, and I hope it stays that way, because for JOEI to become very mainstream, like a New England Journal of Medicine, it'll no longer be JOEI. It'll be something else. Would you agree with that? Is that too much for me to say?
No, I think you're absolutely right. I was, as you were saying that, I three thoughts came to mind in succession. JOEI is a skateboarding, snowboarding, and X Games of academia.
It's a great analogy. It's true. It really is true, because here's the thing. When I went through if Joe Biden started snowboarding, it would be the end of the snowboarding culture. That facts. That's absolutely right. And again, like when I look at JOEI,
nothing against Joe.
No, nothing against Joe. Yeah, exactly. Yeah, nothing against Joe. When I look at JOEI, and this is why I encourage a lot of orthopedic startups to do events, sponsorships, engagements through JOEI, because you guys are the left side of the curve journal. You're on the left side of the adoption curve. You cater to technology enthusiasts and innovators and early adopters, right? Who are going to share these experiences at the very beginning. And the cool thing about this, and this is why I'm excited from an innovation standpoint, pre-JOEI in orthopedics, you would have to go to the conference, hope that somebody randomly walks by your booth, or outside of the conference, the few surgeons who have adopted your technology, that they talk about it to the right people. It's like purely out of luck. JOEI is a hub for attracting those personality types who can see the future with their eyes closed. Like they don't need to see case studies and publication. Oh, so-and-so using everything. They can look at a technology and say, oh yeah, I can see how this would work. And again, to your point, it doesn't have to be a game changer, has to change the game. To
change the game. And every article that we've done, we just published a new article on using augmented reality for if a surgeon was going to do an operation with a resident next week. This study showed that if the resident trains with his mentor on augmented reality together, that case goes better as a teaching case. And I thought that was a very creative use of augmented reality. That the team that was doing the operation is doing the AR together.
See, and things like that. Who knows what the but also the impact of that. Something else I want to bring up. I keep forgetting is I think I'm the only person in the world literally doing this, because it is a real pain to do this. But every month this past year, I've been going and pulling manually all the data from LinkedIn in terms of just 2 data points. How many of a specific specialty are on LinkedIn and how active they are. So on LinkedIn, on Sales Navigator, they show how many people posted content in the last 30 days. And that means they created original content, which is like a super, super small niche group. Okay. This time last year, okay, for orthopedic surgeons, okay, there was about 2,000. Okay, so total they're on LinkedIn, there's about 98,000 total orthopedic surgeons. Okay, 40,000 of those are in the United States. Last year, 2,000 orthopedic surgeons this month published original content, 2,000. Okay. This year, that number's up to 3,000 already.
Wow.
Right. So it's a big jump. I credit Joey for that because, again, I'm noticing deeper, longer academic discussions happening within the orthopedic posts. Last year used to be like, oh, interesting case, this and that. Now I'm seeing paragraphs being written. And what's even more interesting is LinkedIn. If you look at the Pareto on LinkedIn, the 80-20 principle, LinkedIn has almost 1 billion users. I think they're at 950 million. Of the 950 million, little less than 3 million produce their own content. So it's like less than 1%. Okay. Now, what's interesting is that for orthopedic surgeons, the number is almost 7 times that. 7% of orthopedic surgeons on LinkedIn create their own original content. This doesn't count the number of surgeons who log on to comment, to like, to engage, to reshare. This is like creating their own original content. And so what I wonder is, what does that do for innovation and the adoption cycle when there's more awareness throughout the whole year through things like Joey, through the engagement on LinkedIn? Because what might have taken, let's say, 12 to 18 months for like more mass adoption among early adopters might be done within a month or two, because you have these very strong signals in the places where those types of personalities go. Does that make sense?
Yeah, I think you hit a home run there, because it's all the speed of evaluation of that post is the important point. So someone puts up, so we're seeing a lot more clinical posts as well, which means surgeons are seeing it as a safe space to put their clinical content on.
Right.
Right? They're not going to get someone who's, pushing a box in a warehouse commenting on an x-ray. Yeah, I see that x-ray, but my doctor was a jerk and he was, no. That's not LinkedIn. Okay.
Right.
So what happens is you'll put up a case and you'll say, I have this case. Maybe you're from Argentina. Maybe you're from New York. Maybe you're from LA. Wherever you are, you'll put up a case and ask a question. 38 to 60 comments. Unbelievable. Within 3 days. It's almost like viral replication of ideas that all of a sudden, then people you see them changing. Like you'll start off with Herrick Siegel is a big poster of very odd cases. He'll post a case. And then I'm giving you real names. Then Corey Calendine will comment. And then Vin Das will comment. And then Richard Southgate will comment. And I hope I don't forget people. You know what I mean? And then Scott Sigmund, the Fro, he'll always comment. And Kirschenbaum, I'll always comment. And then someone will say something else. And people go, oh, yeah, that's right. I kind of think Russ Bodner is right about this. And you see all these people who before were thinking one way are now going, oh, yeah, Russ is right. Didn't think of it that way. Boom, boom, boom. And in the end, there seems to be a consensus about the case. And they got that in an asynchronous, rapid manner.
Exactly. And what I love is that who knows how long that would have taken for that kind of discussion. That discussion may have never happened, because there's so many things that happen throughout the year. And you're not going to remember these things, all at once and talk about it at the next conference or regional meeting or something. And so
conversations would have happened in the woods, Omar.
Exactly.
And if a tree falls in the woods, blah, 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 it would have happened and no one would have heard it.
Well, kind of how, I don't know what you would call this, but I always saw this is why I started a podcast. So I love reading books. The Gutenberg Revolution was huge for education and learning in history. I feel like podcasting is kind of like the second Gutenberg Revolution, because for the first time in history, somebody could be driving a truck, I don't know, doing chores, everything, and they're listening and learning something, right?
Yes.
And so I don't know what it would be for LinkedIn, but the fact that you can have a case and then have this discussion with the top surgeons across the globe and get feedback in real time, integrate that feedback, and then change your clinical workflow the next day is unbelievable. Yep. And the best part... Oh, no, I was going to say, the best part, think of it like this, is I don't know if I've seen a post like this, but, the other thing is that surgeons can post and learn from international surgeons, because all they got to do, they can just, there's a translate button on post. You can translate to your language. international surgeon can look at it, respond back in their language, have it translated, and boom, you're having, like the impact of that on surgical care and education, it's just mind-blowing to me.
Yeah, I know. It's amazing. Even Matt Barber, who's a friend of mine, he's from Alabama. I always hit the translate button because I'm just digging up
Matt's fantastic, but that New York
whether he listens to me on a video, he's got to hit the translate.
You know what? I'm going to organize that. So for those who are listening, so Matt Barber is from Alabama, and Ira's obviously from New York. That's a podcast. Orthopedic surgeon from Alabama, orthopedic surgeon from the Bronx. There's got to be, I don't know what we would call that, but it's got to be something.
Well, you call it Voices from the Deep South, because I work in the South Bronx.
Oh.
He works in the Deep South of Alabama.
Oh, man. Oh, I love it.
Voices from the Deep South. That's the next one you'll do.
Matt, if you're listening, you're going to have to talk to Ira about possibly launching that. So Ira, just as we kind of wrap up, like, last thoughts, predictions, I guess maybe one question I have for you is, like, coming up, we're going into summer and fall. What are some conferences and events that you're really looking forward to going to? And then anything that JOEI's got coming up?
Well, first of all, I'll talk about JOEI. We just got a lot of more new articles. We're pushing more articles out. We're almost doing 3 journal clubs a month. I encourage people to listen to the recorded journal clubs, which are on YouTube.
Those happen every Friday, I believe.
No, they used to be every first and third Wednesday. Now they're the first 3 Wednesdays of every month, and they're also on our website on the recorded section, which is on YouTube, and they're also on Spotify podcasts. So I prefer people listening to the podcast on the way to work. You don't have to see the video of people talking, but there's some great content there. We're really expanding on the journal clubs. They're actually topic clubs based on the journal article. We're not really talking about the journal article. We're talking about the topic that journal was written about. Okay.
Got it.
As far as conferences, I'm only going to mention one because the rest are specialty conferences. I think everyone has to go to Ortho Summit. Ortho Summit, Evolving Technologies, Kevin Plancher's course. I will give a shameless plug. If you put in OSET JOEI, you get $300 off, actually. Kevin did this with all the faculty. If you put a faculty name in JOEI, faculty name and OSET faculty name, like Antonia Chen, who's an amazing surgeon at the Brigham, you put in Chen.
This is on the check. So this is on the checkouts. People just need to use OSET JOEI and they get $300 off.
$300 off. But OSET, Orthopedic Summit, Evolving Technologies, is one of the last independent, non-society courses that really pushes the limit of connectivity between the faculty and the participants. Faculty is incredibly accessible. What they say on the podium is what they do in practice. But when you go to academic society, this is last thing I was going to say about, there's a difference when people talk on the podium and when they talk on LinkedIn. LinkedIn, they are talking the truth. Podium, they're telling you the party line. And that's what I like about the discussions in social media. That's what I like about the discussions in podcasts. What you get out of people, you personally, Omar, out of people that you interview, myself included, I may never have said these things on the podium, because I have a prepared talk that's meant to be vetted, and 1,600 people at the society said, you can't say this, you can't say that. But here's where the rubber meets the road on podcasts, and you're doing an amazing job. And I want to thank you so much for inviting me.
My pleasure.
I'd come to this weekly, but I actually have a day job. But
Oof, yeah, we'll try and aim for monthly, if not quarterly. But no, it's a pleasure. And again, I'm grateful that somebody like you exists, and more importantly, that you kind of given a place for people to publish in real time what they're doing and influencing their surgical practice. And more importantly, I think this is not talked about enough, so I want to mention it here, is that you'll never be able to measure the impact JOEI has had on patients, because imagine how many surgeons have read something from JOEI that influenced the way they do things, clinically, and that's had an influence on God knows how many patients. So you and the group at JOEI are doing fantastic work, and I just couldn't be happier for you guys, and looking forward to supporting you guys more and having a lot of fun. I'm looking forward to JOEI 2024 mixer, man.
We had another mixer at the show at the
Shoulder 360. I know. I was so bummed. I was looking at that. I got FOMO. I was just like, man, I should have been there.
Yeah. So we, like I said, we're the mixer company. But it goes back to something that I always felt when I was younger. We rubbed elbows at conferences with a lot of famous people, and somehow we started missing that the last few years. And I think LinkedIn, podcasts have brought groups together, and when we do get together at these conferences, whether it's a JOEI mixer or something else, people are already know them already. They're pre-loosened up. That's why Don Buford had 12 people around him, because of what he does on social media. They all knew each other but never met each other.
Yeah, same here, man. I mean, you and I met through the power of LinkedIn,
Yeah.
So there's something to be said about the platform. Well, Dr. Kirschenbaum, Ira, thank you so much for being on the show. I'm going to leave some show notes. So everybody who's listening, please check the show notes below. Again, if you're a clinician, you get a free AMA PRA Category 1 CME credit out of this. I'm going to leave the links for JOEI again. Very simple, JOEI.pub. Go and check out their publication. Be sure to also give JOEI and Ira a follow on LinkedIn, because you'll get a lot of great content there as well. So that being said, I'm Omar Khateeb, your host of the State of MedTech, and we'll see you all next time.
Thank you for enjoying another epic episode of the State of MedTech. If you're feeling inspired and love this episode, do us a favor, hit that subscribe button and turn notifications on so you never miss an episode. And be sure to give us 5 stars and write a short review, because that helps more people discover this amazing community of ours. If you're a company who has a executive that you'd like to be on the show, or perhaps you want to sponsor one of the episodes, shoot us an email at hello@khateebandco.com. Take care, and we'll see you next time.